Hello, my name is Cindy Davidson, and I'm an internal medicine technician at the Veterinary Specialty Hospital of San Diego. Over the past 6 years, I've helped many clients learn how to manage esophagostomy tubes in their dogs and cats. E-tubes, as they're also called, are recommended by veterinarians in situations where a pet's nutritional needs are not being met due to the effects of illness or injury. My friend Kramer here is going to help me explain how to care for a pet with an esophagostomy tube. The following segments will cover E-tube placement, food and medication preparation, the feeding process, and E-tube maintenance and troubleshooting. E-tube placement is a short procedure performed under general anesthesia. A small incision is made into one side of the neck, and a rubber or silicone tube is inserted into the esophagus. An X-ray is then taken to confirm proper orientation, and then the tube is secured at the insertion site with external sutures. A stretchy neck wrap is often used to keep the tube snug against the body. And most pets really don't mind the presence of the feeding tube, and they're actually able to go about all of their normal activities. With some basic kitchen equipment, you have all you need at home to prepare your pet's meal. Your veterinarian will prescribe you with canned food diet and directions on how much water to add and how much food to give per feeding. For example, empty 1 can of food with 1 can of water into the blender. You're going to puree to a smooth, creamy gruel consistency. Pour the food mixture through a strainer into a food storage container. You will have enough leftover gruel for several meals. You can keep the food in the refrigerator for up to 3 days. Just make sure to warm the food up to room temperature before feeding your pet. Draw up the specified amount that you will need for a single feeding. You may need more than 1 syringe for this. Take a separate syringe and fill it with 10 to 15 cc's of water. This will be used as a flush. If your pet also requires medications, most can be given through the E-tube when first dissolved in water, but please check with your veterinarian before doing this, since some pills are ineffective if not given whole. To start, place the pill in a pill crusher or a mortar and pestle to grind it to a fine powder. Next, remove the plunger from a small syringe, and with your finger over the end, pour the powder into the syringe. Replace the plunger into the syringe, and then fill with water. Mix well, and then you're ready to give. When it's time to feed or medicate your pet, find a comfortable spot and have all of your syringes ready. To start, put a small bend in the tube to minimize the amount of air that gets down the tube, and a small amount of air is okay. Next, remove the cap, attach the food syringe, release the bend, and slowly depress the plunger to give the food. You want to give it over 10 to 15 minutes. Slower is always better. Watch for signs of nausea in your pet. These include lip smacking, drooling, hard swallowing, or restless shifting. If you notice any of these in your pet during the feeding, slow the feeding down. If your pet does vomit during a feeding, discontinue and then start over again at the next feeding. It's okay if your pet occasionally vomits. If your pet vomits at the next feeding or vomiting persists, please contact your veterinarian. When you've reached the end of the feeding, once again, clamp the tube, remove the syringe, and replace with the water syringe. You can give the water over 3 to 5 minutes. To give medications only, take the syringe with the dissolved pills. You may need to add an adapter to the smaller syringes. Bend the tube as before, remove the cap, and insert the syringe. You can give the medications all at once, and then follow with a flush of 10 to 15 milliliters, given over 3 to 5 minutes. When you're done flushing, bend the tube, and replace the cap. E-tubes require very minimal maintenance. Once a day, you should inspect the site for signs of redness, swelling, discharge, or foul odor. If you notice any of these signs, please contact your veterinarian. Also once a day, clean the site with a gauze soaked in a mild antiseptic solution. Your veterinarian can supply you with this. Just gently wipe away the skin where there might be some crusts forming. A little bit of crustiness or reddish discharge is normal. Also, inspect the sutures to make sure that they haven't become loose or that the tube cannot move freely in and out of the skin. If you do notice that the tube is loose, please contact your veterinarian as soon as possible. One of the most commonly encountered problems is a clogged tube. The first thing you want to do is try to pull back on the food syringe. Pull back as much food as you can and then empty a small amount of food into the trash. Usually the clog will empty out in the trash can. If that still doesn't work, try a warm water soak. Attach a syringe full of warm water and give until the tube starts to overflow. Recap and let it sit for about 10 minutes. If that still doesn't work, you can actually try a Coca-Cola soak. Take a small amount of Coca-Cola into the syringe, instill as you did the water, and let sit for about 10 minutes. The acid in the Coca-Cola will help break up the clog. If despite your best efforts the tube remains clogged, please contact your veterinarian. The Veterinary Specialty Hospital is open 24 hours a day, 7 days a week at our San Diego and San Marcos locations. There are doctors and technicians available at all times to answer any questions you may have.